right, let's dive right in. We are talking about one of the most popular, most widely used over-the-counter drugs on the entire planet. I'm talking, of course, about ibuprofen. It's a total go-to for literally millions of people when they need to tackle pain, fever, or inflammation.
You know, I'd be willing to bet there's a box or a bottle of it sitting in your medicine cabinet right this very second. And it's this incredibly common, everyday staple that we are going to break down and really understand in today's explainer.
I mean, think about it. We reach for it almost without a second thought, right? But do you really know what's happening inside your body when you pop one of those pills? And, maybe even more importantly, are you clued in on some of the potential risks? That's what we're here for.
So here's our game plan. We're going to cover what ibuprofen actually is. Then we'll dive into how it stops pain. After that, we'll look at common uses and dosing. We'll unpack the risks, and finally, we'll talk about using it safely.
All right, so first things first, let's get a really clear handle on what we're actually talking about here.
Okay, so ibuprofen belongs to this big family of drugs called NSAIDs. You've probably heard that term before. It stands for non-steroidal anti-inflammatory drugs. And its specific chemical makeup gives it these three key powers. It's an analgesic, which is just a fancy way of saying it relieves pain. It's an antipyretic, which means it brings down a fever. And of course, as the name suggests, it's an anti-inflammatory.
And you've definitely seen it on the shelves, probably under a ton of different brand names depending on where you are in the world. You know, you might see Advil or Motrin, or maybe you're more familiar with Brufen or Analgesic. All this availability is exactly why it's become one of the most common go-to pain relievers that people grab for themselves.
Okay, now for the really cool part. Let's get into the science of how this little pill actually provides the relief you're looking for. This is what's happening inside your body.
So it all comes down to this. Ibuprofen's main job, its whole mission, is to block these two specific enzymes in your body called COX-1 and COX-2. The easiest way to think about them is like they're little switches that can turn on pain and inflammation. And, as we're about to see, they've got a few other jobs too.
So here's how that whole process plays out. It's a simple three-step dance, really. First, when you get hurt or sick, your body starts making these things called prostaglandins. They're basically messenger chemicals that shout, "Hey, we've got pain here." And they also cause swelling and turn up your body's thermostat. Step 2, ibuprofen comes in and blocks those COX enzymes we just talked about. You can think of the enzymes as the factories that pump out prostaglandins. So step 3 is the payoff. With the factories shut down, your body makes way fewer prostaglandins. And that means less pain, less inflammation, and a lower fever. Pretty neat, right?
And you might be wondering, how fast does all this happen?
Well, your body gets to work on it pretty quickly. Once you take it, it gets absorbed and hits its peak power in your bloodstream in about 1 to 2 hours. After that, your liver does the hard work of breaking it down. And then finally, your kidneys clear it out of your system.
Okay, so we've covered the what and the how. Let's move on to the really practical stuff. When should you actually take it? And just as important, how much is the right amount?
That standard 200 milligram pill you buy at the store, it's really effective for short-term relief from all the usual suspects. We're talking about your classic headaches and migraines, fevers, that awful dental pain, menstrual cramps, and just general musculoskeletal stuff, sore backs, pulled muscles, you name it.
Okay, this is a number you absolutely need to lock into your brain. For over-the-counter use, meaning you bought it yourself without a prescription, the absolute maximum you should take in a single 24-hour period is 1,200 milligrams. To put that in perspective, that's 6 of those standard 200 milligram tablets, no more than that.
But, and this is a huge but, under a doctor's supervision, that dose can go way up. For some really severe conditions, a doctor might prescribe up to 3,200 milligrams a day, but I have to stress this, that is only when a doctor tells you to and is monitoring you. Don't ever do that on your own.
And that brings us to a really, really important topic. Because even a drug as common as this isn't risk-free. So let's talk about the side effects and the serious warnings that you really need to be aware of.
So it's actually helpful to think about these risks in 2 different buckets. In the first bucket, you have the more common, kind of annoying side effects. These are usually stomach-related, so things like gastric irritation, maybe some nausea or heartburn. But then there's the second bucket, the much more serious stuff. Now, these are less common, but they can happen, especially if you take high doses or use it for a long time. We're talking about serious things like GI bleeding, kidney damage, and even a higher risk of cardiovascular problems.
So this obviously leads to a super important question. Are there people who just shouldn't take ibuprofen at all? And the answer is a clear and simple yes. The medical term is contraindicated, which just means it's a definite no-go for people with certain conditions. This list includes anyone with an active peptic ulcer, that's a sore in your stomach lining, anyone with severe kidney issues, people who know they're allergic or hypersensitive to other NSAIDs like aspirin, and also women who are in the third trimester of pregnancy.
All right, let's wrap this up with some simple, practical advice for using ibuprofen safely. And a huge part of that is knowing what it doesn't play well with. Now, this is super important. Ibuprofen can interact with other common medications. For instance, if you're on anticoagulants, you probably know them as blood thinners, taking ibuprofen can seriously increase your risk of bleeding. It can also make some blood pressure meds less effective. The bottom line here is, if you're taking any other regular medication, you have to talk to your doctor or pharmacist first. Okay, 2 final, simple rules that can make a huge difference. First, always try to take ibuprofen with food or at least a glass of milk. This can really help buffer your stomach and reduce that irritation we mentioned earlier. And second, and this is a big one, avoid alcohol. Mixing ibuprofen and alcohol really ramps up the risk of stomach bleeding, so it's just not worth it. So, I want to leave you with this thought. Ibuprofen is, without a doubt, an incredibly useful tool. It helps millions of us manage everyday pain and fever. But at the end of the day, it's still a powerful chemical that's having a major effect on how our body works. So the question is, for something so common, for something we reach for so easily, are we really giving it the respect it deserves? Something to think about.